Hi, good afternoon. My name is Nurse Alex.
Hi, Alex.
Can I confirm your name on your wristband
Sure. Roel Arroyo,
and your date of birth?
2/16/65.
All right, I'm gonna look at our system right here. Can you repeat your name and date of birth just to confirm what's on the system?
Sure. Roel Arroyo, 2/16/1965.
All right. So, you know why you're here today?
Yes, I'm here for my annual exam.
That's correct.
Examination.
So, can I get your, can you tell me what year it is?
It's 2022.
Got it. And who's the president?
It's Joe Biden.
Joe Biden. All right. So we're going to move on with our health assessment today. First, I'm going to do a general review of your body. So, have you been feeling any fever, aches, chills, pains?
No, I've been feeling good.
Good. So I'm just going to take a look at you. Overall, body's looking symmetric. If I could touch your forehead. Temperature is normal, and your color is consistent with your ethnic group. So I'm gonna move on and take a look at your scalp. I'm gonna look for lesions or any signs of infestation. No lesions or signs of infestation. Skin color is consistent with ethnicity. Skin is warm and dry. So now I'm going to palpate your sinuses. Okay, you're going to tell me if you feel any tenderness. How does that feel?
Feels okay.
Okay. So the head is atraumatic and cerebronormative. I'm gonna take a look at your ears next. All right, we're gonna look at the other side. I'm gonna pull down and back, or down and up, because he is an adult. Looking for any abnormalities. Thankfully, there's no abnormalities in your ear. No excessive amount of earwax. So can I have you close your eyes? And then you're gonna tell me which side you hear the sound on.
Right ear. Left ear.
Alrighty. So we're done with the ears. Now we're gonna look at the nose. I'm gonna take a alcohol test strip, and then I'm gonna hold it and see if he's able to identify it. Can you smell this?
Yes.
Alright, so with the ears, that was cranial nerve 8, and we just tested cranial nerve 1. Both are intact. So now we're gonna test the eyes. Alright. So I'm just going to check your pupil light reflex. All right. And follow my finger. Okay. And look at the tip of my pen. We're going to do the cover test. All right, so eyes are perla, and the cranial nerves 2 and 3 are intact, as well as 2, 4, and 6. So next we're gonna just inspect the nose. No abnormalities, no swelling or blockage. We're gonna check for patency now. So can you cover up one nostril, press on one nostril and breathe. Now the other side. Alright, nostrils are patent. So now I'm going to check your temporal arteries. Alright, temporal arteries are palpable, 2+. This is normal. So now we're going to take a look at your glands. So first we're going to look at your lymph nodes, okay? I'm going to palpate for your lymph nodes. I'm going to check around your head, see if there's any swelling. Please let me know if it's painful or causes you discomfort.
It's fine.
Okay, patient reports no pain when palpating for lymph nodes. Now we're going to check for the salivary glands. And checking the thyroid. Okay, patient reports no discomfort, no palpable lymph nodes, which is a good sign in a healthy adult. So now we're going to check your jaw. So just open and close for me. Now move it back and forth. Alright. So no clicking notice with the TMJ, which is good. No abnormalities found. Now we're going to inspect your mouth. Say ah. Stick your tongue out and say ah. Like say ah. Stick your tongue out more and say ah. Alright. So the uvula and pharynx look to be in working order, no abnormalities. Buccal mucosa had some saliva there, so that's a healthy sign. Gums don't appear inflamed. I see that there's been an extraction and a filling, but overall your teeth look good. No appearance of any other cavities. So now we're going to test your cranial nerve number 7. So can I have you smile? Can I have you frown? Can I have you puff your cheeks out like a chipmunk? Puff your cheeks out like this. Alright, now you can stop. Now close your eyes really hard. Okay, cranial nerve 7 is intact, face is symmetrical. So now I'm just going to have you close your eyes and tell me where you can feel if you can feel this, okay?
Yeah.
Can you feel it?
Yeah, but the camera can't see what you're doing.
That's okay.
Yeah, I can feel it.
Alright, good.
Not good.
So now we're gonna go to your chest, okay? So I'm gonna take a look at your chest. Do you feel any pain in your chest?
No.
No? Alright. So first I'm going to take a close look. Everything looks symmetrical. Can you take a deep breath for me? Alright. Expansion is symmetric. Okay. So now I'm going to listen to your chest. Okay. So I'm going to use the diaphragm to listen to the heart or listen to the lungs. Just take a deep breath in and out. So lung sounds are normal in the front. Now I'm going to use the bell of my stethoscope to listen for murmurs. Alright, no murmurs found. I'm also going to listen to your carotid. So what I'm going to have you do is I'm going to have you take a deep breath in and then hold it. Keep holding. Alright, so for the lung sounds, everything sounded normal. Sounds for the lungs were clear. No presence of murmurs. And for the carotid, it was palpable bilaterally on both sides, +2, and upon auscultation, there is also no abnormal findings. So I'm just gonna have you say the words 9, 9, okay?
9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9, 9.
All right. And so I'm also gonna tap on your chest, okay? All right. So for tactile fremitus, I was able to feel the voice travel through the soft tissues, and upon palpation, the lungs were resonant. Okay, so next we're gonna have you have your back face towards me. All right. So I'm gonna inspect your back. Have you been feeling any pain in your lungs?
No.
All right. So I'm gonna take a listen. Upon inspection, back seems good. All right, breathe in and out for me. All right. So, looking at him from here, upon inspection, his transverse ratio is normal, 2 to 1, and upon auscultation, lung sounds are clear, no presence of any wheezing or crackling in the alveoli or in the bronchioles of the lungs, and the sounds are symmetric bilaterally. So we're just going to have you breathe in and out, check for expansion. Yes, all right, so expansion is symmetric. I'm just gonna tap on the back of on the back. All right. So I'm gonna check for diaphragmatic expansion. So can I have you hold your breath after a big breath? All right, you could breathe out. Okay, so now I want you to breathe out and then hold it. Okay. All right. So for diaphragmatic expansion, it falls within normal limits. It's about this big. All right, so now we're gonna check your heart. I'm gonna inspect the precordium. Do you have any heart pain?
No.
So upon inspection, everything seems normal, no abnormalities in the structure of the chest. So now we're just gonna listen, okay?
Okay.
So this is the aortic. Tricuspid. Or pulmonic, this is the pulmonic. Tricuspid. And then the point of maximal impulse. All right, so no abnormalities. And with the chest palpation from earlier, the point of maximal impulse was palpated and also no abnormalities were found. Did that cause you any discomfort?
No.
All right, very good. So now we're gonna check we're gonna do some neurological tests. So I'm gonna have you close your eyes and you're gonna tell me where you feel the touch, okay?
Right face. Right forearm. Left leg.
All right. That concludes our neurological tests. So now we're gonna check your abdomen. So I'm gonna have you lie down for me. Oh, can I lift up your shirt, sir?
Sure.
All right, thank you. I'm just gonna inspect real quick. So skin color looks warm and dry. It is warm and dry. And there seems to be no abnormalities. Hair growth is symmetrical and skin tone is consistent with ethnic group. So I'm gonna just look for any abnormalities. Don't seem to be finding any. So first we're gonna listen to your your bowel sounds, okay?
Sure.
So I'm hearing the gurgling, very normal. All right. So now I'm going to percuss. How's that?
Fine.
Okay. So now I'm going to gently palpate in a clockwise motion from the right lower quadrant. Tell me if you feel any pain or discomfort, okay?
Okay.
Okay, now I'm gonna press a little harder, okay? So upon palpation, the abdomen seems to be giving me no abnormalities, no abnormal temperature, no swelling. So now's a good time to check on the liver and the spleen. I'm just gonna reach under your rib cage, okay? How's that feel?
Fine.
Still feeling good?
Yeah.
All right. So we're done with the abdomen. So now I'm gonna listen to your aorta and your renal arteries. Very good. So now I'm gonna check your inguinal nodes. You tell me if there's any soreness, okay? How's that?
No pain.
Okay, now I'm gonna check your femoral arteries. Femoral arteries are palpable +2, very normal. So now I'm gonna have you sit up real quick. Yeah, I'm gonna have you sit up real quick. And then I'm gonna check your kidneys. You let me know if you feel any pain, okay?
Okay.
Anything?
No.
Alright, perfect. Now we're gonna lie back down. I'm gonna check your upper extremities first. So I'm just gonna check your temperature. Temperature is consistent with the rest of the body. I'm gonna check the nails for capillary refill, or the fingers for capillary refill. All within less than 2 seconds. I'm gonna palpate the radial pulse. Very good. Now I'm gonna palpate the brachial pulse and the ulnar pulse. All right, all three are 2+ and symmetric bilaterally. And the color of the skin is consistent with ethnicity, and skin is warm and dry. Now I'm going to look at your lower extremities. Skin is also warm and dry. And I'm going to check the dorsalis pedis pulse. The other pulse right here. And the popliteal pulse. All are 2+. Now for a range of motion exercise, can I have you rub the back of your heel on the front of your shin for me? And on the other side. Alright. So with your feet, can I have you push down? Alright, and pull up. Very good. Now same thing with your arms. I want you to pull and push. Push in, push out. And with your neck, push your head towards my hand, push your head against my hand. Alright, very good. Now let's hear about your knee. I heard your knee was swollen.
Yeah.
So tell me when the onset was.
Several months ago, maybe 3 months ago, I turned the wrong way and the pain started radiating from my knee, left knee.
Got it. So
top kneecap.
So
since then it never kind of healed. The pain continues.
Okay, so when it gets hurt, how long does it last for?
It doesn't stop hurting. Maybe it just doesn't hurt as much when I'm lying down, but after walk or after being up on my feet for a long time, the pain gets worse.
Got it.
So
your aggravating factors are walking around and moving things.
Right.
And your relieving factors are just rest.
Yeah, getting off my feet basically. Lying down, sitting down.
So how would you describe your pain? What are the characteristics of your pain?
It's just a knee pain. I can't move it. There's no I can't move it around. Like when I do this, it hurts right here. This point.
Got it.
When I
but
bend my knees.
But anything less than that, it doesn't hurt.
It doesn't hurt.
So this doesn't hurt.
No, it's when it's 90-degree angle. Right there, it started hurting.
Got it. So what's your understanding of your problem?
I don't know. Maybe I had it checked out. They say it's slight arthritis.
Okay.
But I don't think it's that. I think it's more muscle. Maybe the ligament, torn ligament or something. I don't know.
Okay.
Because there's some inflammation on my left knee. the top kneecap. So
So how are you treating it? Are you taking ibuprofen?
I'm taking ibuprofen when the pain gets too much. So
Got it.
that's it.
Okay. So now I'm gonna have you stand. All right. So I want you to walk towards me and walk backwards and bend over. Got it. All right. There appears to be no curvature of the spine, and the patient's gait is normal. Can you take a deep breath for me? All right. And during breathing, patient does not use accessory muscles to aid in breathing. All right. So can you just turn your wrists for me and roll them around, and then shrug your shoulders? All right. Everything seems to be in order, Mr. Ruel. We'll talk more about your knee, and I'll go get you that order for the doctor to take a look at.
Appreciate
Thank you.
it.
Have a good day.